One of the things too, I wanted to bring up, in my lab, we have fixed unit IVUSs, and I train my techs how to control and make measurements. A lot of times I want to, measure it myself. I know exactly what I'm trying to think.
Sure.
What are some things? I mean, what do you recommend? Do you have like your own controls for IVUS on your, are you controlling it or other people?
Yeah, that's a great question. Actually, there are other folks that are usually in the room. I'm lucky. I have two reps that are both all about it.
That's
and
great.
One of the two of them is usually there. And not only do they have expertise and can really show me exactly what I want to see, but and do the diameter measurements and that kind of thing. They've also shown the other folks in the room how to do that. And so I have a really, I think a significant advantage. Because even with turnover and traveling, the avid traveling technicians, those folks get schooled pretty early on how to use the modality, and so that makes it a lot easier. It's just the reps. It's painful.
They're
at first.
great.
Yeah. The repetitions are important. With any new modality, you just have to do it once they're able to see something different and see the kind of the delta in what they were doing before versus what you're able to see, afterwards. People get pretty excited about the modality. And again, set up and that kind of thing with repetitions, it becomes really second nature. Absolutely.
When I first was doing IVUS, I was using the diameter measurement, but I really like the dots feature. And, it just,
agree.
It's just, it's an irregular shape and you get more data. The other thing, sometimes I found a little bit of an issue in my lab is just the cord length. And so I've trained my techs, because you have that, box that you have to connect it to.
Right.
But it's usually mobile, but, sometimes, if the cord was longer, something can be easier, especially if you're going up and over and all these kind of things. Right.
Yeah. And so that's maybe a push to, the two manufacturers that are here in the US.
Yeah.
There's a need for competition and really pushing the envelope. There are so many ways that we can improve, just simple things that we can improve workflow, which I know is one of the cornerstones of one of those particular companies. Let's start doing things. Let's start making it easier and not making obstacles for using a modality.